are happy to have two distinguished cardiologists with us here today to talk about hypertrophic cardiomyopathy, Dr. Andrew Wong and Dr. Anjali Owens. Thank you both very much for being with us today.
Thanks for the invitation.
Thanks very much.
The first one for you all is, what is included in the new HCM registry recognition and site certification here in the United States? Dr. Owens?
So this brand new initiative is set forth to establish an HCM system of care for patients in the United States who have hypertrophic cardiomyopathy, or HCM. What we currently see is fragmented care, that patients get different standards, there's no quality metrics that are used throughout the country. So this program ideally will change that with a series of steps, starting with the pilot program, gathering data, and ultimately putting that data into a registry and using those metrics for quality care. I'll let Dr. Wong go forward with the rest of the program.
Thanks very much, Dr. Owens. So the registry really is intended to gather information about current practice in hypertrophic cardiomyopathy. We have guidelines that are established and recently updated by the American Heart Association and the American College of Cardiology that outlines what high-level or appropriate care for patients with HCM should look like. And yet there's a great deal of variation in how that care is delivered. The American Heart Association has a great deal of history and experience in building registries based around guidelines. In fact, this registry that we're talking about is powered by the Get With the Guidelines team at the American Heart Association to really understand where the treatment gaps are now and try to improve and standardize the care for hypertrophic cardiomyopathy patients. So really it's going to give us a very broad understanding of what care looks like for HCM patients, how it may not be meeting the guidelines that are currently established, and how do we narrow that gap.
Let's talk a little bit more, Dr. Wong, starting with you, about that patient care. What does this do for HCM patient care?
Right, as Dr. Owens mentioned, there's a sort of fragmentation or a wide range of patient care. Some of the patient care for HCM is provided in local community practices or hospitals. Some of it is performed in referral centers, large centers where there's maybe more experience. But at all levels of care, we would like to see improvement in the care that patients can receive, because we know that those improvements are associated with better patient outcomes long term. It mirrors many of the other conditions that we take care of in cardiology: heart failure, atrial fibrillation, aortic stenosis. Those patients with those conditions are cared for at many different levels of centers or care, but really at each one we hope for the optimal level of care, the most appropriate level of care for that particular setting.
Dr. Owens, anything to add to that?
Yeah, I think it's really about improving the lives of our patients. We know that HCM can be a morbid disease. Patients can have symptoms and complications, and the earlier we find them where they are, get them to the appropriate centers and care, the better their outcomes will be. And ideally, we want to prevent the complications that can come from this disease.
And Dr. Owens, where can sites go for additional information on participation?
There is a website that sites can go to get further information. It's www.heart.org/HCM registry. Any
other information that you think people should understand about HCMs in the registry? Dr. Wong?
Yes, thank you. So hypertrophic cardiomyopathy has often been considered a rare disease. I want to thank the American Heart Association for really bringing attention to this condition that often goes unrecognized or not diagnosed in a timely way, or perhaps not managed to the patient's best outcome. So I want to thank the American Heart Association.
Dr. Owens?
And we'd also like to thank Bristol Myers Squibb for being the founding sponsor of this HCM initiative.
Very important information. Thank you both, Dr. Owens and Dr. Wong. Thank you for being with us today.